Hey guys, this is Nai back again with more revision questions for midwifery and answers as well. So let's go. Let's dive right into it. So the question is asking: state three causes of brow presentation. We well know that brow presentation is a malpresentation because we say anything that is not cephalic or where the occiput is not presenting until the labor is treated as a malpresentation or malposition. So brow presentation, or even it's also it has the same causes also with face presentation. It's caused by I think four causes. The first one is the congenital anomalies or malformations such as anencephaly. Anencephaly is when now we have a missing part of the brain. The child is born without the part of the brain. So this leaves us with no option than the as in natana option face na brow kwa ndio ina present. Yeah. The second cause is when you have polyhydramnios or hydramnios. When you have polyhydramnios, that is excessive fluid. We have excessive movement of the fetus such that it allows sometimes the extension of the head, allowing the brow also to present or the face to present. But that cause during multiparity, we have the anterior obliquity of the uterus, of the lax muscles of the the women who have given birth. Their muscles tend to be lax. Sana they have given birth several times. The muscles tend to be lax. They both pelvic, the perineal muscles and also abdominal muscles, such that instead of the fetal axis equally directed to the occiput, it's directed to the face or it's directed to the mentum, the chin, such that the face brow becomes the presentation. Then you have the fourth cause is the okay, it's the contracted pelvis. Yeah, I forgot that one. Contracted pelvis. This is in the case where we have sometimes flat pelvis. It's also in case of cephalopelvic disproportion, where the fetal head is mismatch between fetal head and fetal head and pelvis, such that the kichwa inakuwa stuck. No, inakuwa stuck. So this means the diameters za fetal za mtoto na diameters za the pelvis of the mother, like they are not matching, resulting to the maybe sometimes the head is stuck. If it's in the anterior position and the transverse position, the head might be stuck in the and what is it called, the obstetrical conjugate, the parietal eminences. If it's the posterior position, for sometimes you find that the occiput is stuck in the sacrocorticoid diameter. Yeah. So those are the four causes of the brow presentation. Congenital anomalies example, anencephaly, we have polyhydramnios, we have anterior obliquity of the uterus as a result of the lax muscles, especially in multiparta women, and then we have the cephalopelvic disproportion or contracted pelvis. Yeah, those are the four answers to that question. The other question is asking for complications of brow presentation. So when you have a brow presentation, giving birth might be so hard. Sometimes even it can result to CS kwa sababu if the fetal head is stuck. You see, the labor sometimes is not progressing. The labor is arrested. So it results in what we call obstructed labor. And especially the worst presentation of the brow is where we have a persistent mental posterior position. So it's opportunity CS too. Then we have the other complication in the cord prolapse, because because the face the brow is a ill position, so sometimes it can result to cord prolapse. Then we have during that time process of pushing and the brow, we have facial bruising of the fetal head, such that ataweza kukuwa na edematous eyelids and so lips. Also can result to tracheal or laryngeal edema, such that mtoto akizaliwa atakuwa na what we call the neonatal respiratory distress syndrome. Also because of there's no enough molding yeah, because the fetal head engage vizuri, there's not enough molding of the sutures, the fetal the head the sutures. The fetus may experience what we call cerebral hemorrhage or intracranial hemorrhage. Yeah, I think those are the causes. So let me summarize it for you. I've said obstructed labor, cord prolapse, facial bruising, neonatal respiratory distress syndrome due to the edema of the tracheal and laryngeal larynx, I mean. And then also remember the last one is also during that forcing out of the kichwa kutoka, you might they might be maternal trauma ama perineal traumas. Yeah. So those are the complications of brow. Also, if you ask the 5 complications of face, you'd give the same. Yeah.